Welcome to another easy nursing review. In this lesson, we will cover hyperthyroidism. Before we begin, let's see if you can get this answer correct. A patient is seen in the emergency room with a high temperature, tachycardia, and hypertension. Tremors are noted in the hands. Which problem should the nurse suspect based on these assessment findings? A. Goiter. B. Urinary tract infection. C. Thyrotoxic crisis. D. Overdose of Synthroid. Learn the answer at the end of this video. Now, let's begin by first learning what hyperthyroidism is. Note that this is also known as Graves' disease. Hyperthyroidism or Graves' disease results from an excessive output of thyroid hormones due to abnormal stimulation of the thyroid gland by circulating immunoglobulins. There is an overproduction of T3 and T4 by the thyroid gland that can be caused by an autoimmune disease, where the body's immune system attacks the thyroid gland. Other causes can be a benign tumor resulting in an enlarged thyroid gland or an overproduction of TSH by the pituitary gland caused by a pituitary tumor. The disorder affects women 8 times more frequently than men and peaks between the 2nd and 4th decades of life. Hyperthyroidism is the second most prevalent endocrine disorder after diabetes mellitus. Now let's go over the signs and symptoms of the patient. Here are the following signs of symptoms. Enlarged thyroid gland caused by tumor. Exophthalmos, which is the protrusion of the eyeballs. This is due to lymphocytic infiltration which pushes out the eyeball. Diaphoresis, which is sweating. This occurs due to excess thyroid hormone raising the metabolic rate. Increased appetite due to increased metabolism. Nervousness due to high levels of thyroid hormone. Weight loss due to increased metabolism. Menstrual changes due to elevated levels of thyroid hormone. Now let's go over important labs and diagnostics. For a patient with hyperthyroidism, there will be increased serum T3, increased serum T4, and increased TRH and TSH if the pituitary gland is the cause of hyperthyroidism. Additionally, there will be the presence of antibodies if the cause is Graves' disease. A thyroid scan will reveal an enlarged thyroid. Now that you learned the labs, here are the medications used for a patient with hyperthyroidism. For mild cases and for young patients, administer antithyroid medications such as propylthiouracil and methimazole to block the synthesis of T3 and T4. For Graves' disease and for patients 50 years of age or older, radioactive iodine therapy is used to decrease the production of thyroid hormones. Administer Lugol's solution, SSKI, or potassium iodide, for severe cases where the size of the thyroid gland interferes with swallowing or breathing. The thyroid gland is surgically reduced in size or removed. Administer beta blockers such as propranolol until hyperthyroidism diminishes to decrease sympathetic activity and control tachycardia, tremors, and anxiety. All right, now let's move on to nursing actions. The nursing actions include the following. Monitor vital signs, provide a cool environment, and protect the patient's eyes with dark glasses and artificial tears if the patient has exophthalmos. Provide a diet high in carbohydrates, protein, calories, vitamins, and minerals. Monitor for laryngeal edema following surgery, and keep oxygen, suction, and a tracheotomy set near the bed in case the neck swells and breathing is impaired. Keep calcium gluconate near the patient's bed following surgery. This is the treatment for tetany and is used to maintain the serum calcium level in the normal range. Place the patient in a semi-Fowler's position to decrease tension on the neck following surgery. Support the patient's head and neck with pillows. Monitor for muscle spasms and tremors caused by manipulation of the parathyroid glands during surgery. Check drainage and hemorrhage from the incision line. Red flags are frank hemorrhage and purulent, foul-smelling drainage. Monitor for signs of hypocalcemia. Check for Trousseau's sign and Chvostek's sign. Learn to check for these signs in our other videos. All right, well, you made it to the end of the video. Back to that question at the very beginning of the video. A patient is seen in the emergency room with a high temperature, tachycardia, and hypertension. Tremors are noted in the hands. Which problem should the nurse suspect based on these assessment findings? A. Goiter. B. Urinary tract infection. C. Thyrotoxic crisis. D. Overdose of Synthroid. The answer is C. Thyroid storm is the sudden oversecretion of thyroid hormone and can be life-threatening. Goiter is an enlargement of the thyroid gland secondary to decreased thyroid production. A urinary tract infection would cause hyperthermia, but not the other symptoms. The client with hyperthyroidism would not be on medication for hypothyroidism. Well, that ends this lesson. Check out this nursing video too.